Hello, everyone. We are going to go ahead and get started. We make sure that we're in the right slideshow. Okie dokie. So welcome. I know we have a few people here already and more should be joining momentarily. And then this is being recorded. So if you want to go back and look at this in the future, you're welcome to do that. You should be getting a recording from Stilly Valley Health Connections, and that will come out a couple days after the class. So you'll have access to view in the future. My name is Megan Ellison. I'm a registered dietitian nutritionist and a certified diabetes care and education specialist. And so nutrition and diabetes are my passions. And I'm so glad you're here because if you are in this kind of pre-diabetes range, or even if you have a diagnosis of type 2 diabetes, there's a lot that you can do to help prevent going into full-blown diabetes, or to control it if you already have a diagnosis. And we'll talk through some of those things today. And over the next year, we're actually going to be meeting for a different class topic every first Monday of the month over the coming 2025 year. Let me actually get to this next slide. So the first Monday of the month from 6 to 7 p.m. And we're basically going to work our way through this book by Jill Weisenberger. She's done a fabulous job putting together a complete guide on preventing diabetes and other chronic conditions. It really helps things like heart health as well. So hopefully you guys will stick around for this time frame, and by spacing it out in the way that we're doing it this year, it gives you several weeks in between each new topic and new class to really make some changes. Hopefully you have the book. If you don't, you can rent it from the library. And I know that it's also not that expensive to get through, like, one of these online stores. So it is going to be helpful to have it, I think, because there's a lot of appendices in there, a lot of extra materials at the back of the book that I'm going to be referencing so that you can really engage with this information and apply it to your own situation. So I would highly recommend getting it if you don't have it already. And we are going to work through the chapters 1 through 12 in the book. So basically, we're covering 1 and 2 this week, and then we'll get to chapter 3, which is on dietary intake, next week. And then by the end of the year, we'll have some recap and some extra things to talk about. There's technically 13 chapters in the book. So we will talk about chapter 13 in month 12, but we'll do some extra stuff as well by then. So as you've noticed, we are running this class as a webinar, so I cannot see you or hear you. However, I have enabled the chat function. Oh, let me just get back to there. I'm going to open it up for myself on the side here too. Hopefully that doesn't mess up your view of how you're seeing this. So if you want to chat with each other, you're welcome to do that. And if you have any questions for me, I will check the Q&A box every once in a while. So feel free to type in any questions there. I'm having a hard time advancing my slides for some reason. Try it a different way. Okay, there we go. So prediabetes, what is it and why does it matter? In the United States, about 1 in 3 adults, or almost 100 million adults, have prediabetes. So it is rampant. And the unfortunate thing about this is that most people don't know that they have it. So you guys are in the minority where you're actually already thinking about this and you're aware of your risk. So kudos to you and to your maybe to your healthcare team for catching this and being on top of it. So most of the people who have prediabetes, 8 out of 10 don't know that they have it. So it is kind of a silent thing. A lot of times people don't feel any different. It kind of, is gradually happening over time, or your blood sugar is kind of increasing over time. And without changes, the prediction is that 37% of those with prediabetes will likely progress to having full-blown type 2 diabetes in 4 years. And then by 10 years out, most people who haven't made changes will actually have a diagnosis. So I'm glad you're here now thinking about this. Prediabetes is also associated with some other risk factors like increased risks for heart disease and some forms of cancer. And like I said, oftentimes there's no signs or symptoms, so it kind of comes on gradually. But it's really important to address this, partly because it's expensive, especially if you are trying to stay off of medications. People who are on medications, especially with diabetes, it's usually double the cost compared to people who don't have diabetes. And then, long term, we're thinking about keeping you healthy in the rest of your body. So thinking about heart health, kidney health, eye health, toes and fingers and all those good things. So you may have been diagnosed based on some numbers, some lab work, and there's several different ways to actually identify that blood sugar is high. One way is called this A1C test. A1C or hemoglobin A1C is usually a percentage number. So you can kind of see this first stoplight here. It's got a percentage in it. So 6.5% or above is considered diagnostic of type 2 diabetes. Prediabetes is this range of 5.7 to 6.4, and a normal A1C is below the 5.7. Or maybe when you get your lab work done, you've actually seen an elevated fasting glucose. So the fasting glucose is just a one-time quick check on where your blood sugar is at the moment. Whereas the A1C test, how that works is it's actually like a big picture view. So it is looking at the glycosylation of hemoglobin, or basically the sugar attaching to your red blood cells. And your red blood cells last about 3 to 4 months. So as they're traveling throughout the body, they're picking up more and more sugar. So it's that percentage is a percentage of coverage of your red blood cells. So that's how we get this kind of big picture view of what your blood sugar has been doing for about 3 months or so with the A1C. Whereas with the fasting blood test, it's just a one-time in the moment check. And that's pretty standard, something to check with normal labs. And so if your blood sugar starts creeping up, usually, you're getting this done in the morning. And again, it's fasting, so you haven't eaten anything for at least 8 hours. If it's running in this, 126 or above, then the recommendation is that you get it checked again, because 2 times at 126 or above is diagnostic of type 2 diabetes. The prediabetes range is 100 to 125, so we can see that, blood sugar is kind of creeping up a little bit. And a normal fasting number is under 99. Or some of you may have had a glucose tolerance test, and this is especially true for females who have been pregnant in the past. We often give a glucose tolerance test during pregnancy to check for gestational diabetes. And basically you drink a sugar solution, and here are the numbers associated with that. So 200 and above after that test is indicative of diabetes. Prediabetes is, the range is 144 to 199 after drinking that sugar solution. And really, you know, after drinking the sugar solution or even after eating a meal, a normal blood sugar, if your body was handling that food or glucose well, blood sugar should stay under 140. So that's a normal after eating or a normal after, you know, a dose of glucose. Okay. So a little bit more terminology. So we've talked about the A1C and why that means it's about a 3-month average. So basically those glucose molecules are coating your red blood cells. And then when you go and give blood, we can count that coverage and see what it's looking like. The other thing that you may have heard or terminology you may have heard is impaired fasting glucose or IFG. So that's that elevated fasting blood sugar. So impaired fasting glucose, just meaning like, you know, you're not keeping it below that 100 mark. And impaired glucose tolerance. So the body's having a hard time dealing with that load of glucose at one time. And you may have known about this other type of diabetes, type 1 diabetes, which is a totally different thing. Totally different cause, totally different progression. Type 1 is an autoimmune condition, and that accounts for only about 5 to 10% of the cases of diabetes. This is a typo, 5 to 10% of Americans. That should say 5 to 10% of cases of diabetes in America are type 1. And that does cause damage to the pancreas. So a lot of times people with type 1 diabetes will go on to needing insulin, like exogenous or insulin that they give themselves externally pretty quickly. So, you know, with the damage to the pancreas, where your pancreas is making the insulin, that hormone that helps you control blood sugar, if that is being damaged quite quickly, some people might end up on insulin right away. And we have lots of different forms of insulin now. We've got injections, we've got pumps, we've got inhaled insulin. And in the past, we used to call type 1 juvenile diabetes, but we don't use that term anymore because we actually know that people can get type 1, can acquire it at any time in their life because it is an autoimmune condition. So we don't call it juvenile anymore. And we used to call type 2 adult onset diabetes, but we don't use that terminology anymore because we actually are seeing kids now being diagnosed with type 2 diabetes. So we just call it type 1 and type 2. And then we have other types as well, but these are the main ones. So with type 2, the body is still producing insulin, but what happens is that insulin is not working as effectively, and we call that insulin resistance, or basically the body's losing sensitivity to that insulin. And so the pancreas is actually working harder to make more insulin to overcome that resistance to it. And over time, it just gets tired, it gets burned out a little faster, and eventually the insulin will drop because the pancreas is kind of, you know, getting worn out. And then that's where we really start seeing those blood sugar levels rise and people identifying that they're in that pre-diabetes or that type 2 diabetes range. Okay, so let me just check on I think there's nothing in the Q&A or chat yet. So let's talk about the risk factors for type 2. So there are some things that you can control and some things that you cannot control. So the things you can't control, like your age, you know, it's just happening. Your sex, so men actually have a higher risk than women. Race and ethnicity, so we see in some Asian populations, there's a higher risk. Of course, family history, whether you've had gestational diabetes in the past, that actually increases your risk for type 2 in the future. And then a condition called polycystic ovarian syndrome, which is associated with insulin resistance. So those are things that really are kind of out of your control, but there's a lot in your control, including weight management, your activity, managing your blood pressure, managing your triglycerides, increasing your good cholesterol, your HDL cholesterol, working on heart disease and blood vessel problems, like if you have PAD, for example. Sleep, managing your sleep really well, addressing sleep disturbances, which there's a whole chapter on this that we'll get to in the future. And then, other things like smoking and smoking specifically, but, other inflammatory things that would affect your risk. And if you want to take this risk assessment from the American Diabetes Association, it's available online here, and it'll do the math for you, which is nice. You can just answer the questions, and it'll add up some points and then give you your risk score. But you're here, so you probably are already understanding that you're at a little higher risk. Okay, let's talk a little bit more about insulin. So insulin is like a key. We often use this analogy in diabetes education. It's like the key that opens the door in the cell to allow the sugar to leave your bloodstream and get into the cell where you actually can use it for energy. So a lot of times, my patients, when they're in that pre-diabetes range, they'll say, oh, I'm just craving sugar all the time. And it's not because of a lack of glucose. Like, there's plenty of glucose floating around in your bloodstream. It's just not getting into the cell where you use it for energy. And so a lot of times then the cells are sending out signals saying we're starving. So a lot of times people have those sugar cravings, which is so unfortunate because you actually have plenty of glucose. It's just not in the right place. So we want to help the insulin to work better, which we will talk about, throughout the next 12 months, strategies for that, to make your own insulin that you already have and that you're producing to work better in the body. Insulin resistance is associated with a couple things. So the liver, the muscle, the fat cells are not, reacting properly. And like I mentioned initially, that pancreas is increasing insulin production to try and overcome that resistance. But eventually it does kind of wear out, and then, blood sugar rises. Sometimes people are actually having symptoms in the pre-diabetes range. So I don't know if this is happening for any of you yet, but sometimes people will actually notice some changes in like vision or some nerve issues, like a little bit of neuropathy, like tingling or pins and needles in fingers or toes. So sometimes those are like red flags that your blood sugar is changing. So if you're noticing any of those symptoms, it's a good thing to get checked out. And sometimes people will have symptoms before, their doctor has even said anything about blood sugar increasing. Okay, other effects of insulin resistance. It's also associated with these other health conditions like fatty liver disease, which is rampant in the United States, blood vessel dysfunction, heart, high blood pressure, low HDL, which is that good cholesterol, elevated triglycerides. Part of that is because the body's trying to basically turn the sugar into a stored form of calories because it knows the sugar is running high. So it's turning sugar into fat, which is a triglyceride, is our stored form of fat. So a lot of times triglycerides will be elevated. Chronic inflammation, increased blood clotting. So, there's other reasons besides just diabetes itself to really be getting this blood glucose under good control. And a lot of it comes back to actually heart health. So we will always be thinking about heart health when we're thinking about diabetes. Okay, so here's the good news, because that's all the kind of scary stuff. So you can slow down and even halt the progression of prediabetes. And you can make changes that will boost your insulin sensitivity and protect the remaining insulin producing beta cells in your pancreas that you have. So we're trying to, be very protective and make that insulin work better and not have any, further losses. And we do have really good research showing that small changes make a huge difference. One of the original trials that looked at this, the diabetes prevention program, partly done right here in Seattle, looked at over 3,000 individuals with overweight who had a high risk for type 2 diabetes. And they did an intervention group compared to a group who did not get the intervention. And what they found is that after 10 years, the group with the, well, so initially the group with the intervention reduced their risk by 58%. It was a 3-year study. And then at year 10, they followed up and the group still had 34% lower risk of developing type 2 diabetes. And at 15%, they still had a 27% lower risk. They also had improved cholesterol, triglycerides, blood pressure. They were on less medication. They had less inflammation. So what were they doing? So this is what they did. They had a weight loss of between 5 to 7% of body weight, total body weight. So, not huge amounts of weight loss. Very, very modest weight loss, which, like for a 200-pound person, that would be like 10 pounds, 10 to 15 pounds. So modest weight loss. They were increasing physical activity to 150 minutes minimum per week, which is the recommended amount per the physical activity guidelines for Americans. And they were seeing this reduction in type 2 diabetes. What was really interesting about this is that we saw the older individuals in this study actually had a bigger response, had a greater risk reduction. So, you can make these changes at any time and see significant improvements. And for those who were over age 60, there was a 71% reduction in development of type 2 diabetes, down the road. So, that's the good news. Small changes are going to make a big difference. Here's another study, the Finnish diabetes prevention study, that showed that after 2 years, the incidence of diabetes was less than half in the intervention group compared to those who did not get the intervention of diet and lifestyle, basically diet and exercise training. And those who made the most dietary changes and lost the most weight had the greatest results. So we kind of see this, dose-dependent response where, your blood sugar gets better as you are making more changes and having more weight loss as well. Let's see, I did want to mention this India intervention as well, because this one is interesting in the sense that even without weight loss, so even in those participants who didn't see weight loss, they had a 28% reduction of incidence of, progressing to diabetes with just the diet and exercise changes. So even if you are feeling like, oh, I'm trying to make changes and you're looking at the scale and using that as your only metric of success, just know that, you are having metabolic changes internally and you are doing a good thing, even if you're not getting like, the scale shifting, for example. I know a lot of my patients kind of focus on that, but there's good things happening internally regardless of what the scale says. Okay, so here's some winning strategies from this research. This is basically what the intervention was for that diabetes prevention program. Participants were guided to monitor their weight, keep track of physical activity, reduce calorie intake, eat a wholesome, balanced diet, do a little recording. So actually have some, awareness and some objectivity with food intake, manage their stress, focus on stopping unhelpful, negative thoughts, and develop some problem-solving skills, basically like, reducing barriers to sticking with these changes and maintaining motivation. And we're going to talk about all of these over the next, 11 months here. We will talk about all these different factors. Next week, we'll start with the dietary side of things. But for now, let's talk about what you can do to, kind of wrap your head around, like, where are we headed with this? So again, thinking about the weight loss piece of things just a little bit can reduce insulin resistance if you have extra weight to lose. From a dietary sense, a balanced pattern emphasizing plants and healthy fats we see has a lot of beneficial effects on blood sugar management, and we'll get into details on that next week. With physical activity, anytime you're moving, you are using glucose and actually decreasing the need for insulin because your muscles, if you sensitize your muscles by using them, you actually can take up insulin or take up sugar, sorry, without the need of insulin. That's the one tissue in the body that can do that. So every time you are using your muscle, or if you just have more muscle in general than even sitting here, your blood sugar will be better managed. And that is one huge piece of the puzzle when we think about diabetes or like blood sugar control progressively getting harder to control as we age. Part of that has to do with the natural muscle loss of aging. So we want to be working on that muscle for sure, all of us, because that's going to really make a big difference. In fact, we've seen in research studies that even 2 minutes of activity and movement of using your muscles after a meal helps with that post-meal spike in blood sugar, helps bring it down. So don't get in the mindset of like thinking that you need to do a ton. Something is better than nothing. So I would start with where you're at right now, and just do a little bit more, especially after eating. We will talk about physical activity in more detail in the future, but I don't want you to wait till, I think it's chapter 8. I don't want you to wait till like 8 months from now to get started on an exercise routine because it's so important for you. Okay, and then sleep. So sleep is a really big piece of the puzzle for a lot of my patients. If you have a sleep disturbance or you suspect you have something going on like sleep apnea, you really want to get that addressed. If you know you have it, ideally, you're managing it. Maybe you have a CPAP or some other device that helps you breathe at night and get better quality of sleep. Because if you're not getting that good quality and good length of sleep, it really does affect your blood sugar, and it changes actually your, all of your, not just your blood glucose, but other hormones like your cortisol. It affects things like leptin and ghrelin, like your hunger and fullness, appetite hormones. And so, yeah, so it makes a really, really big difference in your progression of, trying to manage weight and manage blood glucose if your sleep is off. So definitely get that checked if that's going on for you. And we'll have a month where we talk about sleep. Okay, so we're going to dive into chapter 2 because I want to get you started right away with thinking about, this coming year and the changes that you want to make. And I really love this quote. You will never change your life until you change something you do daily. The secret of your success is found in your daily routine. So that is so true, especially for thinking about health. It really is what you do on a daily basis or a routine basis that is going to make a big difference. So for example, thinking about exercise, I would much rather have you exercise for 10 minutes, 6 days a week than one day for 60 minutes. Same amount of time, but that daily routine where you're basically building the muscle of showing up, the frequency of it is really huge. And it's really huge for your blood sugar to be using your muscles every single day. So be thinking about your daily routines as we get into this. So chapter 2 kind of walks you through the mindset of starting to think about, what you want to change, and then actually doing some planning for that change. So knowing what you want is the first step. What's your goal with all of this? Where are you headed? What's your kind of ideal? So that's helpful to think about it and even write it down, put some words to it. Take some time to do some self-reflection, set aside time for some planning. At the beginning here, especially, it's helpful to just like carve out, even if it's like 15, 20 minutes where you can just have some good thinking time. And then, really the long-term changes and like sustainable changes are rooted in that planning and preparation, but I would also say in like realistic baby steps, which we're going to talk about in a minute. And then focus on, the skills, the strategies, habits. It should say instead of willpower. It's not about willpower, it's really about planning, honestly. So that's the majority of the battle right there. Okay, let me just check on I don't think we have any chats. And don't think I have any Q&A. Okay. Righty. So if you have your book in front of you, this will be helpful as we get to this next section. Oh, sorry guys, I'm having a hard time with the advancement of the slide. For some reason let me reshare. Let me see if I can get it to reset. Okay, here we go. So if you have your book in front of you, or just grab a piece of paper, on page 282 is a little prompt for creating your personal wellness vision. And they give you an example in the book, which I find is helpful. This is actually, I think this example is from someone else. I think this is actually from one of my interns at one point. So let me just read this because it gives you an idea of the specificity that we're looking for. So here's an example of a personal wellness vision. I feel strong and mobile. I move without pain in the activities I pursue. I regularly exercise and feel energized every day to challenge my mind and body. At 40 years old, I feel like I am in the best shape of my life. I listen to my body and take action to treat pain as injuries present themselves. I feel healthy and present to the people I love. I take care of my body and am conscious to how my daily decisions affect my health and well-being. I eat delicious, balanced meals that make me satisfied and listen to my fullness cues. I plan and prepare my lunches ahead of time, which reduces my stress and keeps me from eating candy in the afternoons. I may be getting older, but my body feels as strong as it can be. So, he's basically painting a picture here of what he wants. You're kind of thinking down the road with this, 3 to 5 years. What does it look like in the future? If you were to make some of these changes that we talk about over this coming year, what is that going to look like, and what's your vision for where you want to be? And it's helpful to write it in the present tense. So you don't want to say like, I will be doing this. You are saying like, I am doing it, right? Like, this is what I'm feeling. This is what it looks like. So write it in the present tense because that's more strong. Keep it positive. So focus on what you do want, not so much what you don't want. I would actually talk about it. Anytime you can talk about it with a partner or friends or family members, it makes it more real. It makes it more concrete. They can give you feedback. And then go back to it, put it on a mirror in the bathroom or put it on the fridge where you can see it and you're reading it, because you will want to revise it probably in the future. So here's some questions to ask yourself that should be helpful in creating this wellness vision for your future. So first of all, what does your ideal health and fitness look like in the future? And you could go 1 year out, you could go a little longer, like 3 or 5. What activities are you participating in? How do you look? What are you wearing? What makes you happy or energized? What things have you maybe set aside? Like what things aren't bothering you or what worries have maybe gone to the wayside because of your changes? What are the benefits to your new healthy lifestyle? What would it be like if I achieved my ideal level of wellness? What would my life be like at that point? How would it be different from now? And you can ask yourself, what would it be like if I stayed the same? But I wouldn't put that in your wellness vision because you don't want to stay the same. You want to make changes. So I would just put those changes in there. So that gives you some tips. Now that's a big picture. That's like into the future, it's like a North Star. It's like, where are you headed, right? But we want to break this up into more doable chunks. And so I want you to think a little bit more short term because that wellness vision is really a long-term vision. So more short term, you could think in the next 3 months, what habits, routines would you like to have in place? And they really should support your wellness vision, right? And then we want to chunk that into even shorter term than that. So from your 3-month behavioral goals, like what you're actually doing, some very short-term behavioral goals, for example, 2 to 3 small goals that you can meet per week. Because what we find in the behavioral research science is if you try and do too much, then like the whole shebang just gets thrown to the wayside. But if you can focus on a couple things and make them small and realistic and actually very doable, then that success builds on more success. And eventually, you're like this path where you're, hopping and skipping from stone to stone, and you're meeting your 3-month goal, and then maybe you're meeting your 6-month goal, and then maybe you're meeting your 12-month goal. So we need to chunk it up a little bit. So in thinking about that, I want to kind of give you a little bit of a paradigm shift in how you're thinking about goals. Because most of you, if you're like most of my patients, you're probably thinking about outcomes, outcome goals. Like, for example, I want my A1C to be 5.5%. That's an outcome. That's not something you do. That's not a behavior. It's an outcome of behaviors, right? Same thing with weight loss. I want to lose 50 pounds. That's an outcome goal of the behaviors that you either do or do not do. And it's great to have outcome goals. Outcome goals are amazing. And that's usually how we think in our minds. We think about like, what is the end result, right? So totally fine to write those down and have those outcome goals. But you don't really control those things unless you are doing the behaviors to get there. So we really want to focus on what is in your control. What can you do or not do that's going to impact your trajectory towards your outcome goals? So I'll come back to the weight thing because so many people focus on the scale. I'm much more concerned about like, are you, eating your breakfast every day than the number on the scale, or are you fitting in protein at your meals, which we'll talk about next week, than the number on the scale, or are you, adding leafy greens or fiber to your day? Because those behaviors are things you really can control and do. And like, kind of a reference back to the research we talked about earlier, you can be having internal changes, you can be healthier, and the number on the scale might not be changing, right? So you don't want to be discouraged by looking at those outcomes too soon. You really want to be focused on the behaviors so that you're saying like, yes, I'm doing this behavior that's going to get me there. Okay. So hopefully that makes sense. If you have questions about that, let me know. But it's a big paradigm shift in for most people in how they're thinking about goals. All right, so here's some examples of a 3-month behavioral goal. I exercise at the gym or otherwise participate in purposeful exercise at least 4 times per week. So you can see like there's a place or like a specific thing, it's exercise, maybe at a gym, or it's, purposeful exercise, there's an amount, so 4 times per week. And there's even like a time factor here, or at least 200 minutes weekly. Now, this might seem like a lot. For this person, hopefully it's realistic. For you, this might seem like a lot. So I would make this number very realistic to what you can actually accomplish. But notice that it's a specific thing, it's a specific, amount. I would go so far as to making this even more strong of a goal and like, stating when, like what days of the week are you going? What time is it? Do you have a routine with it? So you can make it even, even more specific. Here's another one. So instead of visiting the office kitchen for a snack, I choose my afternoon snack from nourishing foods that I plan ahead and bring with me. This is a big one for a lot of people, planning those snacks so you're not just raiding the candy jar or the vending machine. I pack my lunch every day. Fantastic. Probably it's not every day, probably it's 5 days a week, right? So you could get even more specific with that. I cook dinner most nights from a selection of healthy recipes, and I will give you some recipes over the course of the next 12 months. So, and we'll talk and brainstorm, or I will talk, since normally we run this class as an actual class, but we're doing it webinar style this year so that we can record it and get it out to more people. But feel free to put ideas, in the chat and chat with your fellow participants. So page 283 has a little worksheet for you to brainstorm those 3-month behavioral goals. But let's get even more granular with it. So on page 284, I think, is the goal tracker, where you can write your very short-term goals. So this is like what you can accomplish in the next week. So for example, sometimes the goal isn't even like getting to the action, it's actually preparing to get to the action. So this first example of renewing the gym membership, like that has to happen before you start going to the gym. So sometimes there's like multiple steps in this behavioral change that need to happen in order to get you to actually do the thing. Like you need the shoes, you need the gym membership, you need the friend to meet you for accountability, and then all of a sudden you're going every Monday at 6 o'clock. Like you're showing up here. So yeah, sometimes, it's breaking it down even to like super tiny steps like this can be really helpful. What's another good one? I like number 3 here. On Monday, I'll take 5 pieces of fruit to work, 1 for each afternoon snack. You're setting up your whole week in, one behavior on that first day. Yeah, so you kind of get the gist of this. Again, focus on the behaviors. You are in charge of your actions. And then I love the fact that it like gives you day 1 through 7. So you can kind of track, like, did I do it, Monday through Sunday? How did it go? It gives you an actual objective, measure of what's happening there. And maybe, if you're not meeting your goals by the end of the week and it's really not seeming like it's realistic, then you can go back and tweak the goal. Like maybe it's not a good goal for you. It might not be specific enough. It might be too unrealistic. You actually might not be motivated to it. So you might need to just change what you're focused on at the beginning. So evaluate your goals, and if they're not working for you, you can change them. Okay, so we're going to get done a little early today. So this is your homework for the coming month. You're going to create your wellness vision using the prompts in the book. Carve out some time to think about it, self-reflect. You can go back and review it and edit it after you've talked with friends or family. And then that's your North Star. So from there, I would then think about what are your outcome goals. And you could make that, for the next 3 months, or you could make that for the coming year. What are you hoping to achieve through these classes and education and reading the book and making changes? And then identify how you can turn these outcome goals into actual behavioral goals. So things that you do or do not do. So what is in your control set those specific things. And then from there, you still might need an action plan of how are you going to get to doing the thing, like the example of getting to the gym. So hopefully that's helpful in really like breaking it out for you, and also having, a little bit of time where you're thinking, especially at the beginning of the year here, you're thinking about where are you headed with your health. And we're going to get into more nitty gritty as we go along each month. Feel free to send any questions you have through the Q&A. I don't think we have any right now, but your other homework is the reading. So if you can keep up with the book, read chapters 1 to 3 before next month, then you will be right on track with what we're going to talk about with dietary intake in February. All right, everybody, have a fantastic month, and I will not see you, but I will chat at you in February. All right, take care.